Guys, in this video we want to look at this topic, urinary tract infection. Mainly we want to focus on prevention. Okay, so we will also call it as UTI, urinary tract infection, urinary tract infection. Okay, so basically what are the symptoms? So the symptoms will be like the frequency of urination will increase, dysuria, that is difficulty in urination, hematuria, blood in urine, incontinence, that is no control, right, retention of urine, fever with chills and rigors. So pay attention to this. Sometimes fever, right, can be related to an infection, and the infection can be a urinary tract infection. Urgency to what? Micturition. Strangury. What is strangury? So some kind of blockage or irritation at the base of the bladder, severe pain, strong desire to urinate can be there. Pain over loin or suprapubic region. So there can even be pain over the loin or suprapubic region. Now that you know the symptoms, the first thing we will look at is what is to be done. Okay, so we'll come back to all this pathogenesis and prevention and all. Now let us assume that you have come to this video with those symptoms. So what has to be done? Okay, even before you do anything, right, just take a urine, go to a lab and give a urine sample and ask for urine analysis and urine culture, both of these. So in urine analysis they will check the color, the pH, the quantity, right, all those basic things, and then in culture they will check for the type of bacteria. Okay, so they will try to grow the organism on a media and see what organism it is, and also then they will follow it up at the end with a antibiotic sensitivity testing to know which antibiotic the organism is sensitive to. You know, so what are the common organisms which cause urinary tract infection? Look at the names here: E. coli, Klebsiella, Enterobacter, Proteus, Morganella, Providencia, Pseudomonas aeruginosa, Staphylococcus saprophyticus, Enterococcus candida, that is a fungus, isn't it? Staphylococcus aureus. So here one you can try to remember is E. coli, Klebsiella, Enterobacter, Proteus, all these. Okay, so others are not very common. Pseudomonas aeruginosa, Staphylococcus saprophyticus also. So the investigations will be culture, urine analysis, culture, sensitivity to check for the antibiotic which has to be prescribed. Other things which can be done as investigations, they are saying radiography, etc., to detect vesicoureteric reflux, to detect kidney stones, that is renal calculi, and any other lesions which obstruct the urine flow. So people who have recurrent episodes, right, they can have an intravenous pyelogram, IVP, okay, with post-voiding radiographs. There's a lot more technical information in the textbook. We will just move on. So basically what did we start off with? Let's just take a recap. We saw the symptoms of UTI. We looked at what exactly has to be done, isn't it? As an investigation, immediately take the urine, give it for analysis, culture and sensitivity. Now let us look at the pathogenesis, why exactly the disease has happened, because this culture, sensitivity, etc., as of now takes around 2 days. Okay, so let us look at the pathogenesis of UTI. Bacteria in the enteric flora. Enteric means what? Intestine. So bacteria in the enteric flora periodically they gain access into the genitourinary tract. Why does this happen? Because of the proximity of the anus to the genitourinary openings, and especially this is true in females. Okay, so they are blaming it on the proximity of the anus to the genitourinary opening, isn't it? So this is supposedly more close in females. So let us look at it in male. In male, where is it? The anus is here and the genitourinary opening is here. So in males it is far apart. So then what happens? Now the bacteria from the enteric flora, bacteria has entered the genitourinary tract. Okay. Subsequent bacterial colonization of uroepithelial cells. So what is colonized? The uroepithelial cells. So this will lead to bacteruria. What is bacteruria? Bacteria in urine. So this bacteria in urine, it kind of is a risk to the entire urinary system. Now let's look forward what happens beyond this stage. From here it is going to the bladder, to the kidney and even to the prostate. So how does it go? Via the urethra it goes to the bladder, via the ureter it goes to the kidney, and in men it also reaches the prostate via the ejaculatory ducts. The problem is the urine, our urine itself is a very good, it supports the growth of these uropathogens. They are saying uropathogens, they don't blame only bacteria or fungi. Broadly they are terming it as uropathogens. Okay, so you have understood now, right? So you can see here. So what are they telling? From the genitourinary via the urethra, it's reaching the bladder, then via the ureter, where it let go? To the kidney, and via the ejaculatory ducts it can even reach the prostate in men. In female, similarly via the urethra to the bladder, ureter to the kidney, right? Based on this, the terminologies are like upper urinary tract infection, where it involves the kidney, and lower urinary tract infection, ULTI, you can say lower urinary tract infection, which involves the bladder, prostate and urethra. Okay. We have a lot of mechanisms in our body that can protect us from urinary tract infections. Okay, so let us look at this, like the acidic pH, our normal vaginal flora, cervico-vaginal antibodies, flushing effect of urine when you urinate, right? All these are going to oppose the colonization, bacterial colonization. Also our urethra, our uterovesical junction, these will become mechanical barriers to prevent the ascending bacteria. Okay. The urinary bladder also has protective mechanisms like urine slime, the slime, okay, which covers the bladder epithelium. So it will also prevent colonization. Tam horsfall protein. So this is a protein that adheres to the microorganism and prevents its colonization. So this P. fimbriae, where do you see? In E. coli, etc. bacteria, it is there. Okay. Then urine flow and bladder constriction. So basically what are they telling here? Urine flow and bladder constriction itself will prevent the stasis and colonization. So if you urinate, you are pushing out the bacteria so that you will not give it time to colonize. Who are at more risk to get urinary tract infections? Like if there are congenital anomalies, if there are kidney stones, if there is a ureteral occlusion, partial or total, right, that is from the kidney to the bladder, that portion is called as the ureter. See, first of all you understand this, okay, this is kidney, right, and here you have the bladder. Kidney to bladder, that pipe is called as ureter. From bladder to the outside world, this is called as the urethra. So they are saying ureteral occlusion, so they are referring to the ureter. Okay, then vesico-ureteral reflux. So vesico is what? Bladder. Vesico-ureteral reflux. Some reflux happens because maybe this junction has some issue, okay, some problem, obstruction to urine flow. If it is there, then there can be reflux. Residual urine in bladder. Some urine always remains in the bladder because of some neurogenic problems, a nerve issue. Urethral stricture, prostate, because of prostate hypertrophy in elderly men, it can happen that urine is always getting retained inside, so there is stasis and there can be buildup of bacteria. Okay, so we are here now, instrumentation of urinary tract. So basically this catheterization and all, right, done in the hospital, right, indwelling urinary catheter, catheterization, urethral dilation, cystoscopy. So all these procedures which are done or any catheter left there for a longer time can lead to urinary tract infection. So here they are showing catheter, right, urine collection bag. So all these catheters can lead to urinary tract infection. So that is why these catheters, they have to change regularly, keep it very clean, hygienic, etc. Cystoscopy is what? Basically more like to examine the bladder, right? So they will have a lens so they can see inside. Okay, moving on to the last risk they have mentioned here is women. So women, basically they are talking about pregnancy, use of the barrier contraceptives or spermicides. So basically honeymoon cystitis because of sexual activity, burning sensation when peeing. So spermicide is a cream, right? So what does it do to cause UTI? There are many things responsible here that you're putting, you're introducing something there. It can irritate, right? Allergic reaction. Does it even vary the pH by any chance? So cleanliness becomes a big thing. What is this pyelitis of pregnancy? It is usually found in pregnancy, it's an infection. So they are saying the because of the obstruction of the ureter, because of the enlarging uterus, okay. So guys, now that you have seen the risk factors, now easily you can say how to avoid urinary tract infection also, isn't it? So make sure that first of all, you don't leave the catheter too long. Then you keep a very clean area there around your anus. Don't allow the germs to go from the anus to the urethra. Then what else? Hygiene becomes the main thing, right? So guys, as we told, this video is mainly for prevention of UTI, okay? So when you clean, right, when you clean that area, touch that area, just make sure that the anus is cleaned separately, okay? Okay, and then clean the genitourinary opening separately. Do not go from behind to front, okay? That is when you are taking your germs to your urethra. So just make sure that you clean your anus separately. Never let the content of your rectum, okay, come out, be in the underwear, etc. Because that is where the enteric pathogens are coming in to your urethra, isn't it? Always keep the underwears clean, change frequently. Guys, just another thing is, do not apply anything there, okay? Even calamine or anything you should not use, okay? Do not use anything there. Do not shave. Only trim with scissors, okay? Do not overuse soaps, especially do not put the soap inside it should not enter, okay? Use cold warm water only, okay? Lukewarm water actually. Diapers, guys, there are things with diapers that be cautious in using them, right? And they over dry the skin also because of the chemicals in them, okay? And there is preventive juice like cranberry juice, isn't it? Cranberry juice. So they do give this along with all the medicines, isn't it? Okay, so now let us say that whatever investigations we ordered, we got the report. Okay, now let us look at a report. These are things that will have to be analyzed by a doctor. Okay, so now let us look at the result. What is this? Urine analysis, right? So the color of the urine, the appearance, the specific gravity, the pH, glucose, bilirubin, ketones, and protein, blood, nitrate, WBCs, RBCs, any bacteria. So there are a few bacteria, right? Then lot of other crystals they are talking about. So bacteria if present, then they have to specify significant bacteriuria, etc. Significant bacteriuria is defined as the presence of 1 lakh or more colony forming units of bacteria per milliliter of midstream urine. So there is something like midstream urine. So basically when the urine sample was given, they will take the midstream urine if they want to know if it is there in the bladder. So what if they give the first 10 ml of voided urine, then there will be urethral infection. If it is midstream, it is usually bladder. So significant bacteria, what you have to remember, 1 lakh or more colony forming units, CFU of bacteria. So it will be of a specific type of bacteria. Sometimes it can happen that there is no bacteria also, but it can mean that it is an inadequately treated UTI, etc. Okay. Okay, look at the culture report now. Basically, culture report says pus cells, gram negative bacilli, number of bacteria is 80,000 CFU per ml. It is probably significant but not significant. What is the isolation? H. coli. So they are saying it is Escherichia coli, right? E. coli is present. So this is aerobic. They have taken aerobic specimen of the urine, right? So what is this? 80,000 is probably significant. Okay. Now this is the culture report. Now I ordered analysis, culture, also sensitivity. Now let us move on to sensitivity. Sensitivity means what? Antibiotic sensitivity. Let us see. This is a very good report. It is sensitive to everything on earth. It is sensitive, so that means any of these antibiotics can kill the bacteria. This is a very good thing, but really it is not the case. Okay, normally most of it will be resistant and 2 or 3 will be sensitive in this world and day because of so much of antibiotic abuse. So the main thing is, guys, first give the urine for analysis, culture and sensitivity, right? And that urine should be given before taking any antibiotic, okay, because antibiotics can interfere with your results. So now this is the report that will be given to the doctor. Amikacin, ciprofloxacin, imipenem, meropenem, cefazolin, cefepime, ceftriaxone, tetracycline, cefoperazone, cefixime, gentamicin, piperacillin, tazobactam, that is a combination, okay. Then nitrofurantoin, trimethoprim, sulfamethoxazole, this is what, clotrimazole. So now based on the patient whether they are pregnant or right, based on other things, the doctor will decide which antibiotic to prescribe, okay, and the duration. A lot of things go into choosing the antibiotic based on the side effects, right? What the side effects of the antibiotics will be, what is the condition of the liver of the person, what is the condition of their heart, the blood pressure, etc. Based on all this, they will decide the best antibiotic. Usually now they are saying don't give ciprofloxacin because it is a drug that is reserved for TB, right? So guys, the usual drugs you can know, see in the symptoms, right, they can be asymptomatic, they can be uncomplicated and complicated, okay. Complicated will be like the infections involve the parenchyma, like pyelonephritis, prostatitis, okay, obstructive uropathy and lot of other things, okay. Relapse, sepsis, metastatic abscess, acute renal failure, etc. So what they are saying is, if it is asymptomatic, still the treatment should be given if the person is pregnant or renal transplant patients or neutropenic patients, obstructive uropathy, because pregnancy you really don't want any other complication, right? In uncomplicated UTI, they are saying that ampicillin, amoxicillin, trimethoprim, sulfamethoxazole, etc. Okay. When it comes to complicated UTI, they are talking about gentamicin, tobramycin, ampicillin, ciprofloxacin, etc. So you should understand the drugs. So at least you remember this much. What and all? Trimethoprim plus sulfamethoxazole, ampicillin and amoxicillin. This much if you remember for now, this much should be enough, isn't it? Trimethoprim, sulfamethoxazole, then ampicillin, amoxicillin. They are talking about 3-day treatment, isn't it? At least this much you can remember. For complicated, what and all you can say? Gentamicin. What else have they told? Tobramycin. Okay, gentamicin, tobramycin. You remember, okay? then. Just wanted to add a word here that what they are saying is if they are asymptomatic and it is not at all significant bacteriuria, also they should be given treatment in pregnancy, renal transplant patients, neutropenic patients and obstructive uropathy. Okay guys, just let's close this video then. So they are saying here that efficacy of treatment should be evaluated by urine culture 1 week after the completion of therapy also. Okay, you should do a urine culture again after a week. So they are saying catheters you should use only when it is absolutely necessary. By trained people it should be inserted, right? They should be aseptically inserted, proper sterile techniques. Then once or twice daily perineal care should be done, right? Closed drainage system should be used. Non-obstructed gravity flow should be there, right? You should replace whenever necessary. So that is what they are saying about catheters. Okay. So let us take a recap of what we have seen in this video. We started off with what the symptoms of UTI are, urinary tract infection. Then immediately before taking any antibiotic, the urine specimen must be given for analysis, culture and sensitivity. We looked at the common microbial pathogens which cause UTI. Then we saw the pathogenesis, how exactly it happens, right? We saw the pathogenesis, how the bacteria is entering and ascending. Then we saw what protection, normal protection, natural protection we have against UTI, right? Then we saw the risk factors which are associated, right? Then we saw if the report comes, how exactly it looks, the analysis, the culture and the antibiotic sensitivity. Then we looked at the prevention of UTI, mainly this was the concern of this video, prevention. Then we looked at the treatment, some definitions we saw, asymptomatic, uncomplicated, complicated and what the main treatments are. Then we saw some terminologies like significant bacteriuria, right? And then we saw how urinary catheters use and care. Okay. So that's all for now in this video guys. Hope you have learned something. Bye bye. Guys, nowadays there are things like panty liners available even for men to keep the place dry, okay, and odor free. These can be changed regularly. But the problem with these is they also can irritate the sensitive skin. There are some specific